Hey guys, today we're going to talk about magnesium. Magnesium is a mineral and it's a cofactor in over 300 enzymatic reactions in the body, including protein synthesis, muscle and nerve function, blood glucose control, as well as blood pressure regulation. Today, we're going to focus on what is magnesium and how is it used, as well as magnesium deficiency, how can we identify this, and what would be some resolutions. I'm Dr. Tim with Optimized Wellness Center, and thanks for checking in for this video. Now, if it proves to be beneficial for you, press the like button, share it with your family and friends or others who you think might benefit from this. And if you have any questions, put them in the comments below, and we'll make sure to respond to. Okay, so as we mentioned, magnesium plays a critical role in numerous functions within the body. But first, let's discuss where we can find magnesium. So foods that are rich in magnesium include things like green leafy vegetables, raw cacao, Himalayan salt, seaweed, sprouted nuts, seeds, legumes, avocado, and even certain kinds of fish. The list goes on, and there are many different kinds of foods, but the problem is not everyone is consuming an adequate amount of these. Magnesium is required for the production of energy, giving rise to the very rudimentary importance at a very cellular level. Now, this is where the mitochondria, these are the powerhouses to every cell in the body, require magnesium to produce ATP. ATP is the unit of energy that every single cell in your entire body uses. It's also important as it relates to, this is where our carbohydrates and fats are metabolized to produce energy inside that mitochondria. Now, our DNA and our RNA, as well as proteins, also require magnesium for their synthesis. Magnesium also is required for the production of glutathione, which is one of the most important antioxidants in our entire body. Even our brains use magnesium for hundreds of enzymatic reactions, and deficiencies have been connected to a change in both behavior in humans as well as in animals. Magnesium plays an important role in the nerve transmission and is essential for healthy brain activity. Hypomagnesemia, this is low or deficient amounts of magnesium, is thought to be a physiological indicator for neurologic disorders and has been connected to a wide range of mental health issues. The hypothalamic pituitary adrenal axis, or otherwise known as the HPA axis, is known as the body's stress response system, and magnesium co-regulates this system. Stress depletes magnesium reserves and triggers an inflammatory response, which then accentuates mental health issues in some individuals, and conversely, can be resolved by adequate dietary intake of magnesium. Additionally, boosting magnesium consumption has positive effects in supporting healthy inflammatory pathways associated with neurologic health, as well as our mood and memory. In part, it does this by helping regulating and expelling free radicals like excitotoxins and reducing oxidative stress in the brain. Magnesium is known as nature's chill pill. It does this with its ability to be able to modulate that HPA axis and help us get a good night's sleep. Due to these beneficial effects, topping up your magnesium reservoirs can restore healthy sleep patterns. So do you feel like getting smarter? Well, magnesium is known to give energy and strengthen the synaptic nerve endings in the prefrontal cortex, increasing short-term memory. Magnesium also strengthens the hippocampus to improve long-term memory. Additionally, studies have shown that magnesium has the magnificent ability to grow our brains and retain information by over 100%. Other studies have shown that magnesium can boost cognitive abilities in people with brain synapse function loss and beta amyloid plaque accumulation. Think of things like Alzheimer's and Parkinson's disease. Magnesium is a cofactor that is required for the binding of vitamin D to a transport protein. And moreover, the conversion of vitamin D in both the liver and then in the kidneys into an active hormone called 1,25-dihydroxyvitamin D, I know that's a long name, is magnesium dependent. So vitamin D deficiency is a clinical sign for magnesium deficiency. Harvard-trained cardiologist Dr. William Weglecki published an article dating back to 1992 and even more recently in 2010 entitled "The Role of Magnesium Deficiency in Cardiovascular and Intestinal Inflammation," that proved the intracellular precursor to inflammation is a significant lack of magnesium to run cellular machinery. Other research shows that magnesium deficiency triggers the release of substance P, which stands for production, and although we refer to it for pain, substance P then signals an entire inflammatory cascade of tumor necrosis factor A, as well as interleukin-1 and interleukin-6, and subsequent series of cytokines and chemokines involved in the inflammatory process. Interestingly, this violates the allopathic code that disease comes from the outside. Dr. Weglecki has proven beyond a shadow of doubt that stress will ultimately result in a magnesium loss and then subsequently an inflammatory cascade. In 2012, a study by William Rowe in the Clinical Intervention of Aging titled Correcting Magnesium Deficiency May Prolong Life found that telomere length and it was dependent on magnesium, and therefore our lifespan could be dependent upon magnesium as well. What's important to recognize is that studies have shown that approximately half of all Americans don't consume the RDA, or the required daily minimum amounts of magnesium, which puts them at risk of many different diseases. Certain individuals are more susceptible to magnesium deficiency than others, especially those with GI disorders like chronic diarrhea, Crohn's, and celiac disease, surgical removal of parts of their stomach, small intestine included, and intestinal inflammation. Renal or kidney disorders like type 2 diabetes, or folks using medications like diuretics, or endocrine and metabolic disorders, again type 2 diabetes, as well as parathyroid disorders or excessive lactation, and then also consider folks like the elderly as well as alcoholics. Because of the numerous body functions that require magnesium, conversely, its deficiency could possibly play a role in many health problems. Magnesium deficiency is associated with things like cardiovascular disease, where we would see things like cardiac arrhythmias and palpitations, or metabolic disorders like metabolic syndrome or hypertension or type 2 diabetes, insulin sensitivity. And it's utilized in medicine regularly to help prevent strokes, as well as dealing with heart surgeries or preventing seizures with preeclampsia or eclampsia, and preventing brain damage within infants. There are certain drugs which may deplete magnesium. These include things like proton pump inhibitors, antibiotics, birth control pills, statins, corticosteroids, diuretics, hormone replacement therapy, anti-inflammatory medications, as well as antiviral medications. There are others as well, but these are just some big hitters in that space. Frank clinical deficiency may include symptoms like weakness and fatigue, ataxia. This is where people lose control of their body movements, as well as muscle twitching and spasms, or low blood levels of calcium or hypocalcemia, osteomalacia, as well as hypokalemia, where you have low levels of potassium, and vitamin D deficiency, as we spoke about earlier. Moderate magnesium deficiency may include things like osteopenia, osteoporosis, soft tissue calcifications, and kidney stones, as well as high blood pressure or hypertension, preeclampsia, migraines, and cardiovascular diseases. So what are some of the risk factors? Well, clearly the standard American diet, or the SAD diet, where people are eating low levels of plant foods and high levels of refined foods, would put them at high risk. Also, another cause would include things like malabsorption. This could be from vomiting or diarrhea or ulcerative colitis or pancreatitis or disorders causing fat malabsorption, as well as chronic alcohol abuse, are some other factors that can cause malabsorption. And don't forget some of the things like urinary wasting, where people are utilizing diuretics, or sweating and burn injuries. And in this instance, don't even think of injuries as being very significant. It could be merely athletes or individuals using saunas that would have a higher demand for magnesium. There are also some syndromes that have lower blood levels of magnesium. These include things like hungry bone syndrome, where the magnesium moves into the bones, and it's related often with the surgical removal of the parathyroid glands. Or refeeding syndrome, and this is where there's an aggressive correction of starvation or chronic malabsorption. Think of like alcoholics or eating disorders. There are some signs for toxicity, though, where we have hypermagnesemia, and this has two conditions that are closely associated with this. One is where there can be a lower BP or blood pressure that would be very dangerous, where you'd have bradycardia or tachycardia. Paradoxically, this can cause hypocalcemia, which is a classic feature of magnesium deficiency. Therefore, many of the signs and symptoms of both the deficiency and toxicity are the same. Another one is where you have poor kidney function, where higher doses of magnesium are used for medical purposes. And think of instances of preeclampsia or eclampsia. It could also be associated with excessive use of over-the-counter medications that include magnesium, and this would be things like milk of magnesia or antacids. Although many studies point to the benefit of increasing dietary intake of magnesium, it's often hard to diagnose magnesium deficiency due to the fact that just 1% of magnesium is present in our blood. The majority of magnesium is stored in our bones and in our organs, and therefore hard to measure. So taking steps to ensure adequate intake is really imperative. There are some ways to test for magnesium, though. The magnesium tolerance test is really the gold standard, yet unfortunately it's both invasive and cumbersome. So alternatively, we can rely on things like serum levels or blood levels of magnesium, as well as measuring within the red blood cell and urine. Serum levels tends not to be as sensitive, but it is a reasonably accessible alternative. Utilizing these last three, serum, red blood cell, and urine, tend to be a great way to be able to measure it. You take all three and then you correlate these and allow a doctor to help you to interpret those findings. Correction of magnesium deficiency is really important. So if it is due to having a high level of refined foods and therefore not enough of unrefined plant foods, we should be eating more magnesium-rich foods. If it is not practical, possible, or sufficient to be able to achieve appropriate levels by doing that, then supplementation may be appropriate. And in this case, we often use magnesium glycinate or magnesium malate. There are some other routes of administration where we can nebulize magnesium, and this is where we start to breathe in magnesium and it enters in through our lungs, and this is utilized often with asthma patients. Another mechanism is using a transdermal absorption of magnesium, because our skin is a very large surface area, and so often people will put magnesium into their baths, or they will spray it on themselves or use it as a topical lotion to be able to absorb that magnesium. All right, guys, I know we got through a lot of material here. I hope this was beneficial for you. Please press the like button and make sure to share this with other individuals, and I'll look forward to catching up with you in the next video.